This is Anders. He's thinking about whether or not to take melatonin supplements to help him sleep tonight. But he decides not because he knows that melatonin supplements have an absurdly high concentration of melatonin in them. So he will sleep tight tonight. But this is Durs. He is also thinking about taking melatonin tonight. So he decides to take a gummy with 2.5 milligrams in it. Little does he know that this will severely interfere with his body's natural production of melatonin. This will mess with his sleep in future nights. While melatonin can be used to help shift your circadian rhythms, most supplements contain 1 to 10 milligrams, which is an absurd amount. Your body naturally produces about 0.0000026 milligrams per milliliter, as seen in this graph. That means, on average, you're taking 10 to 100 times the amount of melatonin you'd naturally produce at peak nighttime, an hour before you would actually go to sleep. This can severely interfere with your body's natural production of melatonin. Healthier alternatives to melatonin include the supplements magnesium glycinate, about 200 to 400 milligrams 2 to 3 hours before sleep, theanine, 200 to 400 milligrams, glycine, 2 grams every third or fourth night, and GABA, 100 milligrams every third or fourth night. Recent sleep literature has supported the use of these sleep protocols as useful for helping aid the onset of sleep.
This is Nathan. He thinks that by wearing sunglasses, he can improve his sleep by protecting himself from the blue light that is coming from his TV screen and the lights above him. While this might be true, reducing all light and distractions 30 minutes before bedtime is the best way to help your REM cycle. Additionally, making sure to let sunlight hit your eyes every morning helps you optimize your REM cycle by letting your body adjust to your ideal sleeping schedule. Santi does this and feels energized every morning.
People often think that snoring is unproblematic, but as you can see, Nathan is suffering from blocked airways and sleep apnea from snoring, which can affect sleep. When Nathan nose breathes while sleeping and avoids snoring, he can sleep nice and peacefully. Snoring and sleep apnea is caused by blocked air pathways, which makes sleep difficult and can cause drowsiness and decreased attention the following day. If left untreated, sleep apnea also leads to more severe issues, such as heart disease, stroke, and high blood pressure. Ways to prevent snoring include sleeping sideways and using back posture machines, jaw surgeries and orthodontics, and nasal accessories like nasal dilators or nasal strips.
As you can see, when the temperature of the room that Alex is sleeping in is around 70 degrees Fahrenheit, he is actually far too hot to fall asleep well. While most people think that the ideal temperature for sleeping is around 70 degrees Fahrenheit, the ideal range for sleeping temperature is between 60 and 67 degrees Fahrenheit. This is because your body actually cools down while sleeping. This happens because your circadian rhythm is not only in charge of your sleep, but also your temperature regulation, cognitive function, hormone secretion, metabolism, and the release of tryptophan.
In this video, Anders is experiencing a sleep terror. You can tell because sleep terrors are characterized by major motor activity and considerably more anxiety, vocalization, and autonomic discharge than what one would experience during a nightmare. Additionally, patients experiencing sleep terrors wake up confused and usually are unable to remember their dreams. Finally, sleep terrors occur out of slow-wave sleep and happen during the first third of the night. However, in this video, Anders is experiencing a nightmare. You can tell because nightmares usually don't involve major motor activity, and one experiences considerably less anxiety, vocalization, and autonomic discharge than what one would experience during a sleep terror. Additionally, patients experiencing nightmares usually wake up aware and with good intellectual functioning. They also usually remember their dreams in vivid detail. Finally, nightmares occur out of REM sleep and happen during the last third of the night. Many people believe nightmares and sleep terrors to be the same thing, but as you can see, nightmares tend to be significantly less intense than sleep terrors.
While eating before bed leads to heartburn, stomach aches, and digestive problems, which can hinder sleep, eating foods such as turkey or dairy, which have high levels of tryptophan in them, make you fall asleep quicker. As you can see in this first video, Alex is having trouble falling asleep after eating French fries due to stomach aches. But in the second video, Alex falls asleep pretty quickly, although he may still experience stomach aches and heartburn, but falls asleep quickly due to the high levels of tryptophan in turkey. Tryptophan is an amino acid needed for protein production and muscle maintenance and can also cause drowsiness. This is because tryptophan travels in the bloodstream to the brain, where it is then converted into serotonin, which makes people feel sleepy and fall asleep at a much faster rate.
As you can see, Alex is returning from a long class. He feels a little tired, and he checks his watch to see he has 45 minutes until his next class, so he thinks of a great idea to take a short nap, which is most effective when it's up to 45 minutes. He turns the blinds down so that you can't see any light as he's trying to fall asleep. He sets his timer for 45 minutes and gets into bed to take a quick nap. If you want to take an effective quick nap, you should allow yourself up to 45 minutes. If you want to take an effective long nap, you should allow yourself only 2 hours. After waking up, looking at natural light can help you rebalance your circadian rhythm and internal clock. But it's important to keep in mind that you need 15 minutes after you wake up from a nap to actually feel alert. Caffeine takes 15 to 30 minutes to take effect, so if you're going to take a short power nap, it's okay to drink caffeine before then. But if you're going to take a longer nap, you should not drink caffeine because the effects of caffeine can last for 3 to 4 hours, and that can disrupt your ability to get good sleep while you're napping. But it is helpful to take caffeine after you have napped to feel more alert. And remember, any sleep is better than no sleep.
This is Santi and her friends, and they're about to smoke some marijuana at the end of the night because they're under the impression that it helps them with their sleep. It's true that using marijuana can help someone fall asleep if they're anxious or stressed at bedtime, like insomniacs. This is because the psychoactive component in marijuana, THC, can have the effect of reducing a person's stress levels and make them feel relaxed, because the THC binds to the cannabinoid receptors in the amygdala in the brain. This can shorten the time that it takes someone to fall asleep, increasing the overall time that they're asleep during the night. However, what Santi and her friends don't know is that ingesting THC in marijuana has the adverse effect of delaying REM sleep during the night. This means that a person will miss out on REM sleep in the beginning and middle stages of the night, and often only experience REM at the very end of the night. In fact, if marijuana is frequently used over a long period of time, a significant REM sleep debt can be incurred. And if this individual were to stop using marijuana, they might experience intense and vivid dreams because their brain is trying to make up for all of the REM sleep that it knows it has lost.
Thanks for watching.